basically to say it's about time we stopped talking down the COVID vaccine rollout. And that is because it's generating fear and anxiety in the community. Now, Mr Deputy Speaker, this government has been open and transparent about the issues that we have faced. And those issues are well known across this country. And that is because despite the noise from those opposite, despite the noise that people are generating about this, who have a vested interest in saying things like, should be another government running this government, it is because we know the Australian community has trust and respect that the Morrison government has their back. Now, I would like to talk about some of the issues that this government has addressed, and it's addressed it calmly, it's addressed it openly, and it's made sure it's taken the Australian public with them. And the first thing to say is the issue of supply. Now, Mr Deputy Speaker, perhaps people on the other side haven't noticed, but it's very clear that there has been a supply issue globally. And that is because COVID has been raging internationally. And there is no doubt that the international agreements that this government has had with countries in Europe in particular have actually not been supplied because those governments have been more concerned appropriately about their citizens and the risk of dying in their country than they have about their customers. Now, that is very understandable. But what is important for the community in Australia to realise is that this government has the back of Australians when it comes to supply. And that is because this time last year, when we were facing the initial pandemic, which was coming at us at speed, the Minister for Health, Greg Hunt, had to deal with an initial supply issue, and that was the supply issue of PPEs, masks, gloves and gowns. And he dealt with that extremely well by ensuring that we had step up of manufacturing onshore, particularly of masks and gowns, so that we had a sovereign supply. And he knew at that time that Australia was dealing with what was something that was coming with us at speed. And I had people in my electorate call me and say, local GPs, I don't have enough masks to get me through the next few days. And Greg Hunt, the Minister for Health, was able to step up that manufacturing capability with great speed and with great diligence. But he knew back then that our sovereign capabilities were incredibly important for Australia's future, so that when other people were concerned that we weren't going to even have a vaccine, as early as September last year, he organised an agreement with CSL to ensure that we had sovereign supply here in Australia with AstraZeneca. And there is no doubt that using AstraZeneca as the backbone of our vaccine rollout has been incredibly important. Now, I do want to raise the issue not of just supply, but of side effects. Now, Mr Deputy Speaker, I've been known publicly to say that I believe that the side effects of AstraZeneca are not a problem that we should be talking about in great depth. Because when you look at the side effects of AstraZeneca, you're more likely to die going to your vaccine appointment than you are from the side effects of a vaccine side effect. Now, the ATAGI, which is the evidence-based group that has been providing us, the Morrison government, with the information, has recently released a statement that talks about the safety of the AstraZeneca vaccine. Now, the ATAGI has been informed by a world-class therapeutic goods administration, the TGA, which I think all Australians understand that it's of the top quality, and we have always said as a government that we will make sure that safety comes first and that the rollout of this vaccine would be to put the health and safety of Australians first, and that there is now clear diagnosis and treatment pathways for responding to cases of the vaccine-associated clots that have been associated with AstraZeneca. Now, this is because previously these clots were of an unknown origin and medicos were not sure about how to treat them, but this has now changed and the outcome and prognosis has considerably improved. So there were 22 patients who have already recovered from vaccine-associated clots and have been discharged from hospital. Unfortunately, one person has died from TTS in Australia, but the risk of side effects from clots from AstraZeneca are put at less than 1 in a million. This is a very low side effect. So the good news is Australians, I think, are understanding, as we look at the COVID lockdown in Victoria, how important the vaccine rollout is to their health and safety of themselves, their loved ones and all Australia. And I'm pleased to say that now that the supply issue has been sorted out, we understand how to better treat the side effects of the COVID vaccine. Australians are embracing the demand for the COVID vaccine, and we have some short-term scheduling issues that are being resolved as we speak, but hand in glove, all governments are working together to roll out COVID for the good of the Australian people, and I commend the government's work in this area.